everyone. I'm Dr. Rashi Agarwal, MD Neuropsychiatry. Welcome back to part 4 of the Peripartum series, and today we are going to discuss bipolar disorder. For that should know that what is bipolar disorder. See, there are two types of bipolarity. Bipolar 1. In bipolar 1, a patient should have had an episode of mania as well as a clinical depression phase in the past. That's we categorize as bipolar 1. Then in bipolar 2, the patient has clear-cut known episodes of clinical depression, but only hypomanic episodes, which are manic episodes but not severe enough to warrant any attention or clinical admission. Now, both kinds of bipolarity are very common in the peripartum period. First of all, we will see two kinds of patients. First, who had bipolarity in the past and who got pregnant. Second, who had new case of bipolarity as soon as they delivered or during the peripartum period. Overall, worldwide, the incidence of bipolar disorder is 4.4%. It is a huge number to warrant attention for us. People who already had bipolar 1 in the past, 50% of them have a chance of having a recurrent mood episode as soon as they deliver. Even 25% of them can go on to have a psychotic episode because of the peripartum. Second, in bipolar 2 patients also, approximately 25 to 30% of them have a high chance of developing a mood episode as soon as they deliver, which is increased in timing and also in the duration because of this condition. When we see the stats, males and females, they have approximately same lifetime incidence of catching a bipolarity, but women have more amount of depressive episodes in the bipolarity, and also they have increased during the menstrual cycle, the peripartum period, because of the fluctuating hormone level, as we had already discussed. There are various factors for increasing in the mood worsening in the postpartum period, which, as discussed, is bipolarity in the past. 7 times it is more common than developing an acute depressive episode. During the acute episode, it is difficult to distinguish if the person is getting it for the first time during the peripartum, whether it is bipolarity or towards the peripartum depression. But bipolarity, as we said, 7 times approximately is more common. And in acute episode, our main concern is to get the patient right back on track, and we can keep the diagnosis little aside to deal with it further. Now, we should always keep a suspicion of bipolarity whenever we are dealing with patients of mood disorders. The first thing that we have to do is clinical monitoring. Yes, the first doctor that the patient comes in contact with obviously is their obstetrician, who is looking after them during their peripartum period. Second, if it warrants attention severe enough, a psychiatric evaluation is necessary for continuing the treatment. If the patient was a known case of bipolar disorder, we strongly advise to consult with a psychiatrist for a follow-up visits, as many mood stabilizers levels are hampered during the pregnancy due to the fluctuating fluid levels in the body. Both lithium and valproate change their levels during the pregnancy. Sudden stoppage of mood stabilizers that the patient was already on warrants increased incidence of having any mood episode immediate in the postpartum period. Hence, monitoring is very essential. And even if the patient is getting a new episode, first is clinical evaluation and second is pharmacotherapy that we have to start, so that the patient does not go on to develop any threatening, like going on to develop a psychotic illness, or further going on to develop suicidal ideation, threats to herself as well as a newborn baby. She needs clinical monitoring. Aside from that, also non-pharmacological measures like light therapy, especially bright light therapy, like a place tropical country we are living in, we are exposed to sufficient light, but still bright light therapy and also cognitive behavioral therapies are warranted when consulted with a good psychiatrist or a clinical psychologist. Evaluation is necessary. We are going to bust some more myths and get maximum people aware about the illnesses which are just shunned off as being normal mood swings. Thank you.